As students are heading back to school, it's a good time to make sure they know how to recognize a medical emergency and when to ask for help. And joining us this morning is Hannah Gopaul, a paramedic with Chesterfield County EMS. She's going to share with us some important safety tips when it comes to families. Hannah, great to have you.
It's good to be here.
So as we know, the countdown is on for a lot of parents, maybe kiddos as well. School starts back Monday for a lot of kids. What are some of the most common medical emergencies that EMS crews typically see when it comes to the kiddos?
So a lot of the medical emergencies that we see when we're responding to schools and in pediatrics are going to be your seizures, severe emotional distress, some injuries that occur, breathing problems, and allergic reactions.
All right, Hannah, so for kids, they may be apprehensive perhaps depending on who we're talking about, but speaking up we know is critical, especially when an emergency happens. What is your message for the kids to know, when I need to reach out to an adult for help?
So we want kids to know that it's never wrong to speak up, even if they think it's the littlest thing that's wrong, that their health and that their safety always matter, and that they can tell a trusted adult even if they think it's the littlest thing.
What are some of the symptoms that kids should look out for that, hey, I may need this assistance? What should they be watching?
They should be looking for any difficulty breathing, if their face is swelling, lips, tongue, seizures, if they have sudden onset of confusion, and even in our athletes, they need to look for worsening symptoms, dizziness, repeated vomiting, and maybe some balance issues as well.
Yeah, we know especially with those athletes, with back to school comes like football practices, band as well. So of course, that is top of mind for a lot of people. So if a student witnesses something where a parent, guardian, or teacher isn't around, what do they need to do in an emergency? Perhaps if a student is having a seizure or struggling to breathe, what is the first thing you suggest for them?
If there's not a trusted adult or anything around, they should be able to call 911 immediately. If that patient's in a seizure, then they should be able to move the stuff around the patient, just to make sure they don't hit their head or hit anything causing them more harm, and to never hold them down.
And as a paramedic, I'm sure you're used to working with children of all ages. For parents at home that may be wondering, when do I start teaching my kids, some of the most important things like when to call 911? What is your suggestion when, I guess, kids start to grasp that concept?
So it's never too early to teach someone when to call 911 for an emergency, but usually about the age of 4 is when they begin to start understanding that concept. And you can teach them how to call 911 on phones that they're familiar with, have them know their home address, and know that that dispatcher is going to be asking them a lot of questions that they need to be able to answer.
All right, Hannah Gopaul with the Chesterfield County EMS. She shared a lot of great information for the parents and kiddos as they prepare to begin another school year. We thank you so much for your time.
Yep, thank you.